Dear friends, today our lecture will be devoted to functional anatomy of skull. We'll discuss many interesting things about the skull, including skull as the skeleton part, functions of skull. Then we'll discuss phylogenesis and ontogenesis of skull, methods of its investigation, structure of the skull bones articulations, sex and age-related peculiarities, then anomalies of skull development and skull evolution. I think skull is one of the most interesting parts of the skeleton because it hides the brain as a mysterious part, and it serves the place of rest for many sense organs. The study of skull starts from the prehistoric times, probably from the studies of cannibals. And till now, some cannibal tribes exist in Central Africa and in Papua New Guinea and on some islands. The scientists have found many skulls with artificially enlarged occipital foramina, and some of the skulls were broken and probably the content was removed to be used as a food. At the beginning of the 19th century, the Austrian anatomist and scientist Franz Josef Gall was the founder of the new science called phrenology, from the word phreno, meaning soul or spirit or conscious. He believed that the traits of character have the specific areas in brain and are reflected as the protruding parts of the skull. So the more exaggerated is the feature, the more protruding is the tuber or part of skull. And opposite, if something will be lacking in the character, that portion of skull had a depression. Of course, that was a false science, and because of that science, even Charles Darwin, who was the founder of the theory of evolution, was at risk not to get to his famous ship Beagle to make his theory of evolution. So nowadays, we consider that this was a false science. The great contribution to this study of skull was made by Soviet anatomist, anthropology scientist Mikhail Gerasimov. You see him on the picture below. He worked at the reconstruction of the images of the appearance using the remains of the skeletons from the different graves. He reconstructed about 200 of different people, of different historical personalities, including Cro-Magnons, Australopithecus, then some historical people like Tamerlane, like Ulugh, like Ivan the Terrible. Functions of the skull are many, and they include protection for brain, protection for sense organs like taste, olfaction, vision, hearing, and balance, then food chewing, support for initial organs of respiratory and digestive systems, and serves the place for muscles attachment. In evolution, the skull has developed much because of various factors. They are like changes of the food preferences, then bipedalism, opposite to quadrupedalism in apes, then brain development, sense organs development more with dominating of the vision, and speech, of course, also influenced the facial part of skull. So if we'll compare the skull of apes like chimpanzee and human, you can see here on the slide that the chimpanzee has heavier mandible, protruding zygomatic arch, smaller skull and less volume of skull, sagittal crest, which serves the muscles of mastication attachment, then blunt or receding forehead, heavy brow ridge, and protruding maxilla and mandible, both jaws, and that is called prognatism. The canines, which are bigger and heavier than in human, they are distinct features of the other food that chimpanzee prefers. The red line here on the slide indicates the prominence of the jaws in apes, including chimpanzee. And morphological features of the human skull includes prevailing development in height, then convex frontal regions, large parietal bones, the development of mental protuberance, the formation of the protruding bony nose, reduction of brow and smoothing of the occipital relief, and reduction of masticatory brim, and more tender appearance. Like all other bones, all other parts of skeleton, skull is composed of bony tissue, including bony cells like osteoblasts, osteoclasts, and osteocytes. Osteocytes are mature bone cells, while osteoblasts are their progenitors, the bone-forming cells. Osteoclasts are the cells that destroy the bony tissue. They break down bony matrix for remodeling and release of calcium. So bone remodeling, bone growth includes all the function of all three type of cells. In evolution and also in ontogenesis, skull develops in different modes. So the facial skull and the roof of skull, it undergoes only two stages of development that are called fibrous, and then comes ossification. So connective tissue then ossifies. While the base of skull, it has one most intermediate stage, that is cartilage. Means the connective tissue is replaced by cartilage first, and only then comes ossification. In future, that will mean the different potential for the bones fusion, for the bones healing. For example, if any bone of the roof of skull will break, it will hardly fuse back or can be healed, while base of skull cracks, for example, after the road accidents, they are more severe, more dangerous, having more complications, but they may fuse back, they may be healed. Now I'll tell that in detail. So these two modes of embryonic development of skull, they are called intramembranous ossification, so when mesenchyme transforms directly into bone, and endochondral ossification, that is for base of skull, replacement of chondrocranial cartilage models by bone occurs in multiple centers of ossification, and that appear usually between 8th and 16th weeks of gestation. In embryonic development of skull, on the left slide, you can see the formation of sense organs. Number one are the future parts of nose that are nasal vesicles. Number two are visual vesicles that will transform further to eyeballs. Number three are connective tissue parts covering the skull from the top. Number four are hearing or auditory vesicles. On the right slide, you can see how the facial skull is formed. From the fish stage of embryonic development, there are 5 pairs of gill arcs. Between the first and second pair of gills arcs, there is a slit that will transform in future to the tympanic cavity that is called, in other words, as middle ear. The first gill's arc will form mandible, and that's why it's called mandibular gill's arc. So it forms mandible and two hearing ossicles residing in the tympanic cavity. They are malleus and incus. The second gill's arc, it will form the third hearing ossicle, the stapes, and also will form the lesser horns of the hyoid bone. While the third pair of gill's arc, it will give rise to the larger horns, greater horns of the hyoid bones, and the body of hyoid bone. All other arcs, they will participate in the formation of cartilage of larynx, and number 5 will reduce in time. This will become rudimental. This picture represents well how the facial skull and will be developing in a different mode compared to the roof of skull. So the roof of skull bones will be like continuation of the mesoderm of the precaudal connective tissue. So this will be somites that are precaudal. They will rise up above the developing brain and cover from the top, while the facial skull will be originating from the gill's arcs. Here are they. And this process is happening starting from the 5th week of gestation up to 8th week. During 9th week of gestation, the centers of ossification appear, which will grow up into frontal bone and occipital bone, and only later on they will become bigger until the small connective tissue portion will remain in between them to form a fontanelle. And cartilages appear in the maxillary part, mandibular part, and the base of skull, including occipital bone. Here is the natural picture of an embryo of early stage, and you can see here frontal protuberance or prominence. Here is the nasal prominence with its medial part and lateral part, and the groove in between them. These laterally are visual prominences, then maxillary below, maxillary prominences, and mandibular prominence. Initially that was a groove between two parts of mandibular prominence, but then it fused. By 9th week it's fused already, so we can see the complete mandible. Below the mandible that will be the heart prominence. So this picture represents well what will happen if there will be a malformation, if the embryo on the early stage of gestation will be exposed to any hazardous agent. So that will cause the anomalies like, for example, unfusion of the nasal prominence will cause a slit-like space in the middle of the face and double nose, biorrhenia. Normally, these two parts of nasal prominence should be growing front and medially to form the entire external nose. The laterally seen well visual prominences, they should move medially and stop above the external nose to form two orbits where the eyeballs will reside. So the inability to migrate medially will result in the condition called hyperthalarism, when the eyeballs are on the side of the head. And that is a severe lesion. The inability of maxillary prominences to migrate medially and below the external nose can result in cleft lip and cleft palate. In Latin, that sounds as labium leporinum and faux lupina. And mandible split is seen very seldom. So this is the general plan of how the cells are migrating. We use different methods of investigation of the skull, like palpation, examination, and craniometry. Craniometry, from the word cranium, that is skull, and metry means measurement, that is measurement of skull sizes. We use specific skull points that are landmarks on skull used for proper anthropometric measurements. For example, the cranial index is measured between the most distant, that is the most distant points between the temporal bones, divided to the distance between the root of nose protruding portion, that is called glabella, and the external occipital protuberance. And in percentage, that will be cranial index. So less than 75%, we call this skull as dolichocranium. Dolicho means long, cranium skull, so it means elongated skull. More than 80%, that we call brachycranium, that is a round-shaped skull. And from 75 to 80, this is mesocranium. This is an average skull like all of us, majority of us are. The next is measuring of the height index. What do? We measure the distance between the great occipital foramen, the base of skull, till the highermost point of the skull, and divide it to the distance by the distance between glabella and external occipital protuberance. In percentage, that will be height index. Less than 70%, we call it hemocranium. So the vertical measurement and the horizontal measurement ratio. More than 75%, this is hypsicranium, and 70 to 75 orthocranium. And here I'm showing to you the elongated skulls. In many religions, the skulls were deformed artificially, as that served the criteria of nobility of the person. The next is measurement of the facial angle. So we make a vertical line between the glabella and the alveolar process here above the teeth, and the horizontal process will correspond for the zygomatic arc, this one, and the angle will show us this facial angle. So less than 56%, this will be degrees, this will be prognatism. Then more than 72 degrees, that will be orthognatism, and from 56 to 72, this is normal, like all of us, majority of us. While examining these skulls, we are looking on it from different view, and this view or image we call norma. So if we look front onto skull, we call it, or anterior, we call it norma frontalis. Here is number 2. If we look from the top, we call it norma verticalis. From the back, that will be norma occipitalis. From a side, that will be norma temporalis. And from the bottom view, that is norma basalis. And here is how it's represented. Facial, norma, lateral, basilar, occipital, and vertical. One more way to study if the skull is okay, if there are any lesions or deformities or any other pathology, we use X-ray. The rules of narration or interpreting of X-ray I've told you when we discussed the bony system. So X-ray is a negative film, means the more thick, the more dense tissues are looking like more bright, while the more loose tissue seem dark. For example, here is the shape of skull, and we can see that the orbits are less loose than the maxillary sinuses that are inside the maxillary bones, because they are filled in with air. We can see here the ethmoid bones labyrinth and even frontal sinus. The teeth and the ridges of orbits are the thick parts. They are very dense, therefore they are seeming more bright. That is examining of norma frontalis, so frontal view, anterior view. From the lateral view, that is norma lateralis, we usually see the ridges, the zygomatic arc, the safety and the condition of the maxillary sinuses and the teeth. And that's a good thing to watch the Turkish saddle here inside the skull. If the person has any or is suspected any pituitary tumors, usually this Turkish saddle is exposed, and so norma lateralis X-ray films serve as the diagnostic option. Using the X-ray, we also can see the differences between the skull of adult and a child. You can see not only proportions are different, but even the length, the density of tissues are different. And that is, of course, supposed to be like that. Here you can see even the suture between the frontal bones, which are not fused, so that will be the sagittal suture. And the sinuses are almost closed, like frontal sinus does not exist. The cells of ethmoid bones do not exist, and maxillary sinus is very, very small. In many cases, X-ray films help us to understand the real age of a person. Probably you have heard that not always the biological age corresponds to the passport age. And X-ray helps us to understand that. Also, for skull examination, we use MRI and CT scan. MRI more often because it shows us dense tissues. CT scan less often, but anyway, we also can apply that.